Welcome, everyone, to Vet NeuroJar, the podcast where we crack open the fascinating world of veterinary neurology. I'm your host, and today we're diving deep into a topic that affects two of the most popular breeds around, Pugs and French Bulldogs. These breeds, with their charmingly smushed faces and playful personalities, are beloved by many. But as it turns out, their unique build can predispose them to a variety of spinal issues. So, we're going to explore a recent study that sheds light on the specific spinal diseases that commonly affect these breeds. This information can help owners, breeders, and veterinarians better understand, diagnose, and manage these conditions. Now, before we get into the nitty-gritty, let's set the stage. Pugs and French Bulldogs, or FBDs as some call them, share a similar body type. Both are small, brachycephalic breeds, meaning they have those shortened snouts we all recognize. Because of these similarities, they are prone to some of the same health problems like breathing difficulties and eye issues. But what about their spines? Are they equally at risk for the same spinal diseases?
That's the question this study aimed to answer. Researchers at the Royal Veterinary College in the UK conducted a retrospective study, looking back at medical records of pugs and French bulldogs treated for spinal disease between 2010 and 2022. They reviewed a mountain of data, including the dogs' ages, how their symptoms started, whether they were in pain, and their neurological exam results. Importantly, all the dogs had a confirmed diagnosis based on advanced imaging, like MRI or CT scans. After sifting through all the data, they ended up with 439 French bulldogs with 448 diagnoses and 106 pugs with 125 diagnoses. So what do they find?
Well, the results were quite revealing. It turns out that French Bulldogs and Pugs are prone to different types of spinal problems. The most common culprit in French Bulldogs was acute intervertebral disc extrusion, accounting for a whopping 84.3% of diagnoses. That means the soft cushion between the vertebrae suddenly burst or herniated, causing sudden pain and neurological issues. On the other hand, Pugs were more likely to suffer from spinal arachnoid diverticula, SADS, and chronic intervertebral disc protrusion, with each accounting for about 24% of the diagnoses. Spinal arachnoid diverticula are fluid-filled sacs that develop within the spinal canal, putting pressure on the spinal cord. Chronic disc protrusion, unlike the acute extrusion, involves a slow bulging of the disc over time. These differences in diagnoses also translated into differences in how the disease is presented. French Bulldogs often had a sudden onset of clinical signs. About 62% of French Bulldogs showed acute onset of spinal issues. They would suddenly show signs of pain and neurological deficits, sometimes quite severe. Pugs, in contrast, typically had a gradual, chronic presentation. The majority, 74.5%, had a chronic onset. They might have a long-standing history of weakness, incoordination, and, interestingly, a higher prevalence of urinary or fecal incontinence. So, why these differences between the breeds?
Well, the study authors point out that while pugs and French bulldogs share some similarities, they're distinct breeds with different genetics and spinal anatomy. One key difference may lie in a gene called FGF4. French bulldogs have a high incidence of a specific FGF4 retrogene insertion, which has been linked to a higher risk of acute intervertebral disc extrusions. Pugs, on the other hand, have a much lower incidence of this genetic variation, which may explain why they are less prone to acute disc problems. Another factor to consider is vertebral malformations. Both breeds are known to have a high prevalence of congenital vertebral malformations, like Hemivertebrae, where the vertebrae are misshapen. However, the types and clinical relevance of these malformations can differ between the breeds. For example, Hemivertebrae and French bulldogs are often associated with their screwtail. In contrast, pugs tend to have different types of hemivertebrae that are more likely to cause clinical problems. The study also found that pugs were more likely to have multiple spinal issues occurring at the same time. About 17.9% of pugs had concurrent diseases compared to only 2.1% of French bulldogs. This can make diagnosis and treatment more challenging in pugs. Now, let's dig a little deeper into some of the specific conditions highlighted in the study. First up, acute intervertebral disc extrusion in French bulldogs. As we mentioned, this was by far the most common diagnosis in this breed. When a disc suddenly ruptures, it can compress the spinal cord, leading to pain, weakness, and even paralysis. The study found that most of these disc extrusions occurred in the thoracolumbar region, which is the middle part of the back, but a significant number also occurred in the neck. Next, let's talk about spinal arachnoid diverticula, SADs, in pugs. These fluid-filled sacs can develop anywhere along the spinal cord, but are often seen in the thoracolumbar region of pugs. The exact cause of SADs is still unknown, but it's suspected that genetics and vertebral malformations may play a role. Pugs with SADs often present with a slow, progressive hind limb weakness and incontinence. Chronic intervertebral disc protrusion was another common diagnosis in pugs. Unlike the sudden rupture seen in disc extrusions, disc protrusions involve a gradual bulging of the disc into the spinal canal. This can cause chronic compression of the spinal cord, leading to similar signs of weakness and incontinence. Finally, the study highlighted hemivertebrae with kyphosis as a relatively common finding in pugs. Hemivertebrae, as we discussed, are misshapen vertebrae, and kyphosis refers to an abnormal curvature of the spine. When these two conditions occur together, they can cause significant spinal cord compression and neurological problems. It's important to acknowledge the limitations of this study. Because it was retrospective, the researchers were limited to the data available in the medical records. There was no standardized diagnostic protocol, so some subtle lesions might have been missed. Additionally, the study excluded dogs with multiple spinal issues at different locations, which may have affected the prevalence of certain diagnoses. Despite these limitations, this study provides valuable insights into the spinal health of pugs and French Bulldogs. It confirms that these breeds are prone to different spinal disorders and that their clinical presentations can vary. This information can help veterinarians narrow down their list of potential diagnoses, choose the most appropriate diagnostic tests, and discuss treatment options and prognosis with owners. For owners of pugs and French Bulldogs, what does this all mean?
First, it's crucial to be aware of the potential for spinal problems in these breeds. If you notice any signs of weakness, incoordination, pain, or changes in urination or defecation, seek veterinary attention right away. Early diagnosis and treatment can make a big difference in the outcome. Second, work closely with your veterinarian to develop a comprehensive health plan for your dog. This may include regular checkups, weight management, and exercise modifications to protect their spine. If you're considering getting a pug or a French Bulldog, talk to your veterinarian or a reputable breeder about the potential for spinal issues and what you can do to minimize the risks. So, there you have it, a deep dive into the spinal diseases of pugs and French Bulldogs. While these breeds may face some unique challenges, with the right knowledge and care, they can live long, happy, and active lives. Remember, early detection and proactive management are key. That wraps up another episode of Vet Neurojar. Thanks for tuning in, and remember to keep those minds inspired, hearts light, and tails wagging.